I always find it's incredible how a normal-looking person with some crowding can be made to look worse by having their teeth pulled out and effectively their facial structures dragged back. And by the same token, someone who maybe has a relatively normal-sized nose, that nose can also be made to look quite big by having their face dragged back. And conversely, someone with a large-looking nose can be made to look like they actually have a much smaller nose when their face is balanced correctly and looks properly. What's your experience of that?
Well, I think facial balance has a lot to do with the position of the upper incisor teeth and the size of the upper jaw. So if you have a well-developed upper jaw in the correct position, then that sets up the essential balance of the face so that you could move the lower jaw to match that. I think when we talk about what can happen from a damage point of view to the face, the landmark study would be the study that was done by Dr. John Mew, where he looked at identical twins. And in the past, many people would blame adverse facial changes, post-orthodontics, related to not the orthodontics, but just to bad luck, and that's the way the face was going to grow anyway. John looked at it from another point of view. He said if we have identical twins, then in theory their face should mature the same. And the only difference in the treatment in the twin study he did, one set of twin had the traditional approach, which involved removing teeth and standard orthodontics. The other twin had the functional jaw orthopedic approach, where John had developed the upper jaw, actually pushed the front teeth out further than most people would think were necessary, and brought the lower jaw to balance that. And if you look at these twins now, 10, 15, 20 years after that study, you can clearly see the difference that has occurred. I find that in modern day practice, many people who have suffered the fate of traditional bicuspid extractive orthodontics are now looking for methods to improve their lip balance, such as Botox, such as dermal fillers. Next week I've been asked to speak at the Australian Academy of Anti-Aging Medicine, and they want me to talk about what can be done after teeth have been removed to try and improve lip balance. So I think certainly people are aware that it does happen, and most of the public have noted the change, but really haven't put two and two together, and that's why I think it's so important for us to promote the whole aspect of where that the teeth and the lips have a good balance and a good relationship, and ultimately the lip is the curtain to the teeth.
Yep.
So in certain faces, particularly those who have large noses, you don't want to bring those teeth back because it will flatten the face.